It's all about that new trend that the government says is very worrying. At least 21 counties have now registered cases of COVID-19, sparking concern over a further spread. The government is now fast-tracking mass testing in the country to determine the true extent of the spread. Chemutai Goin reports on the developments that came as the number of positive cases over the last 24 hours rose to 216 after 8 more were confirmed.
For the last 1 month, this daily briefing has mainly featured Nairobi as the major epicenter of COVID-19. But now the government says the virus is moving deeper into the countryside, sparking new concerns.
From down south in Kilifi to Mandera in the north. From the west in Vihiga to Kitui in the east.
Out of the 216 confirmed cases so far, Nairobi has the lion's share with 101 cases, but Mombasa now has 34 cases, Kilifi 10, Kiambu 7, Mandera 6, and Nakuru 5 cases. 8 other counties, namely Laikipia, Kajiado, Murang'a, Kakamega, Nyandarua, Siaya, Uasin Gishu, and Kitui recorded 2 cases each. Homa Bay, Kisii, Nyeri, Vihiga, Kwale, Nyamira and Machakos recorded 1 case each, and the ministry is warning that it could get worse if the outlined precautionary measures are not adhered to.
We must work even more closely with our county government to tighten our control measures, to harmonize our responses, and mobilize our people to take an active role in this fight.
But there is one more statistic. The virus is not just going for the elderly.
We have about 5 patients who fall within the age group of 0 to 14. We have 15 to 19 falling to 58 in terms of count. And we have about 64% of our cases falling between the age group of 30 to 59, again affecting the productive members of this society.
The government is now fast-tracking plans to carry out mass testing. At the Kenyatta National Hospital, Health Principal Secretary Dr. Susan Mochache was already leading health workers in the mass testing exercise. The results from here expected in not more than 5 hours.
Today we want to do about 400 to 400 because there's enough testing kits right now in the country for us to ensure that we have checked the status of all our health workers, because we cannot afford to have health workers going down at a time like this. They are our frontline soldiers and we need them healthy.
Already at the isolation unit at the Kenyatta National Hospital, 2 doctors, 4 nurses and 1 clinical officer are receiving treatment after testing positive for COVID-19. The government says they are leaving nothing to chance. Out of 17,000 testing kits currently in the country, 12,000 will be utilized for the first phase. The Ministry of Health is currently reviewing the areas that will be clustered among the priority areas. The Ministry of Health had projected 10,000 cases by the end of April, but so far, testing has been slow, with only 8,827 people reached so far. Experts say the real situation will only emerge once the planned mass testing is carried out in the country. As the government increases the rate of testing, it is warning that the coronavirus spread has moved from urban counties to some of the rural counties. And it is apparent that hard decisions may have to be made going forward, including limiting inter-county movements. Chemutai Goin, Citizen TV, Nairobi.